Hello and welcome to part two of our areas to know for healthcare leaders and healthcare project managers. So in this part two, where we're going to talk about the next area for the front end access, which is the registration. It's called the patient registration. And essentially what happens during the patient registration is it's actually the process of collecting, recording the patient's personal and insurance information in order to create or update the medical record for accurate treatment and billing. So the medical record is essentially like a chart where all the patient's information has been collected. It's going to include different parts that we're going to talk about. And it's also where providers, in this case, any clinician that's going to treat a patient will need to reference or refer to as they want to either understand the patient's prior history for healthcare, for medical, or depending on which department, they may want to also see what her insurance, his or her insurance is, and if they have insurance or if they don't have insurance, and that kind of thing. And then also later on, during the reimbursement or the billing of the patient services, that the reference also for different reasons. Same thing, it will be either the past history, the diagnosis that's been given, and also the services provided in addition to the insurance. So essentially, it's the same place that will keep all the patient's information. Okay, so what are the three things that are needed? The three things that are needed are essentially the patient ID and demographic information, which is going to be collected. In other words, patient identification information, okay? And the next part we're going to look at will be also the patient's insurance information, as I've mentioned before, and then the patient's medical history. So going back a little bit deeper here, for the patient's identification information. You could separate these, but I wanted to add them because, they are for the patient's information essentially. So the patient's identification information is going to include their name, their gender, the date of birth. The date of birth here is DOB, just acclimated that, their address, their contact information. So contact information will include things like um, their email address, their phone number, whether it's cell or phone. And then also there's where they're asked if the preference is to call their home number or cell phone or email and that kind of thing. In addition, also the social security number or any other number that they may have. DMV is really the driving license number. Usually these are items that are collected when a patient checks in at the front desk and they're kept in their chart or record. The next part of this is a demographic information. So demographic means that usually these are items that you can run a different data analysis on, especially, I'm not saying that they run patients' data, but it's where it's a collection from a demographic perspective of information that will be used, especially when they're trying to determine specific items about patient population, health population, and things like that. Okay. So here, demography also may include the gender, even though it's also up on the identification, the marital status, the age of the person. The age, of course, is going to be derived from their date of birth, but it's an item that, is collected. The system usually will calculate that. It's not that they'll ask someone how old are you necessarily, or sometimes they might, but most systems will calculate that. The language and ethnicity and race. There are other items under these items. However, I'm going over you know, um, the main items that are collected at the front. The next one is going to be their insurance information. So this is whereby when someone also checks at the front desk, they're going to ask them. Sometimes it's when they call in actually to make an appointment. It could be a new patient or it could be a patient that already is seeing the doctor. And every so often, especially beginning of the year, they tend to ask people if the insurance has changed. The reason for this is people's insurance tends to change because especially when someone is working and the insurance is from their work, it follows a kind of a calendar year or certain dates, timelines. And if you're someone maybe who's had insurance this way, you will recall that there are certain, they call them enrollment dates within the insurance, and they tend to be towards end of the year, where the cutoff is sometime in December or even could be end of December, that kind of thing. Having started probably in the last quarter, meaning October, no, October, November, December. So it could be October, starting in October or the month before September until December. Okay. Hence, what is usually collected under here is they're going to find what the insurance company is, in other words, the insurance provider. So these are going to be companies like, the Aetna, the United Healthcare, the Blue Cross Blue Shield, which sometimes now has also changed its name. It's under a different name. But those also tend to be at times called by different names in different states or markets. So those are the main ones I've talked about, but definitely there are many others. There's Magellan, there's Mass Mutual, there's all kinds of different ones. Okay, so depending on what insurance someone might have. And then they'll ask who the member is or the subscriber, and then the dependent. DEP means dependent. So by member, it means they tend you subscribe within that collective, and that is what they'll ask, that who is the actual person who holds the insurance and who then is their dependents. As you may know, that when you get insurance, they usually give you those forms to fill out that someone has to say if you're the main subscriber or you're the main member, who are the people that depend also on this insurance, hence like family insurance. Okay. The next item will be they will request probably for the insurance policy number and then also the group number. These are two different things. So there will be there for sure what the policy number is and also the group number. The group number is where by just going a little bit on the insurance side, is whereby a collection of a group of people, usually this may be a company, it could be a small company, a cooperative or things like that, or a small business, but they create a group and that group is given a number. So that's where they know what those numbers are, okay? The next one would be the effective. Effect means effective and expiration dates. And by this, meaning that when the insurance starts and when it's set to expire. Okay. Like I said before, there usually is an enrollment period within the insurance. Usually, if someone is continuing with the same insurance, all they have to say is, nothing has changed. However, there are some companies, especially larger ones, organizations that may have probably a choice between one or two that people can choose, especially the multinational, multi-state, multinational, international. They may have different insurance types depending on where someone resides. So that is where this comes in for sure, the effective date and the expiration dates. Also, what happens is during this time, there are different types of insurance, and there's what they call the HMO, and there's what they call the PPO. So you find that PPOs tend to be open. HMOs tend to be health management organization, meaning they tend to manage those that insurance type a bit more, and they're not as common now, but I know especially in the West Coast that is still there. It's pretty prevalent there. PPO tend to be more open, provider provider uh, plans that are open organizations. So you find that they tend to be open, and so they may not have necessarily the effective or expiration dates. However, some may have that also. Um, but it all goes back to where those dates are, someone needing to enroll or re-enroll within the insurance if they're not changing it. In addition to this, there's some other details that may be requested or required depending on the type of insurance that I talked about, if it's an HMO or a PPO. But we won't go into that right now. This is really high level, but the main items that will be requested are the ones above. All right, so going to the third item, it's the patient medical history. So what does the past patient medical history entail? Usually what this entails is what the person's history has been. So, sorry, medical history. So they may ask for past illnesses, past diagnoses, and if someone has had any surgical procedures or not, if they've had them, when did they have them, what hospitals, if they've had any accidents, like real accidents or not, and also if they have had any other types of insurances. This could also entail medication, what someone is taking currently. I think if someone has been at the hospital, usually they'll ask that, what's your medical list, or what medications is someone taking currently, that kind of thing. And then the other part of that is the family history. So the family medical history tends to be, if especially there's so many, if you get these forms to fill out, they will tend to be a long list, but essentially it's either, usually medical illnesses that tend to be more on the aggressive side, or more that may be hereditary, or more that might be that they tell the history of how maybe someone behaves, or um, what probability of getting some um, illnesses could be in the future or not. So things like they usually ask is diabetes. Has anyone in your family has do you have it? And has anyone in your family had diabetes? The other one could be any type of cancer. They'll break that down probably, but just any type of cancer. Has anyone in your family had this before or not? And then they'll also ask some other things like kidney disease. Has anyone in your family had that? So those kinds of questions. Those are the main things that will make up a chart for a patient. So by the end of that registration, what happens is that they'll have created a good chart. Obviously, this changes sometimes. As a patient, they may add more information, or they could subtract. By subtraction, I mean, obviously, you can't go back and change things in terms of if you had surgery and things like that. But where they might remove them is, for example, if someone is getting better, they were taking certain medications, and they have to take those medications off the list because they don't need them anymore, they're no longer taking them. So that kind of thing. Okay. Anyway, so those are the main items that are needed for registering a patient within a patient registration system. And in the context, therefore, of a leader or a healthcare project manager or program manager, what happens is that each of these areas may have a project. So that is the reason that I'm talking about it. Each area within the project journey may have a project for someone to work, because either they're optimizing it, they're making better, or there's things that may have come up. A big problem within the registration that is prevalent almost in every organization is duplication, where patient names are duplicated, and you have a patient who may have more than one chart showing up. And this usually happens, obviously, when during the registration, someone may have given a name And so that's why you find that many times they'll ask people now to provide their driver's license or some kind of ID, because they'll use that officially to get the person's names, just even starting off, rather than asking the person, what are your first names? They could be Margaret and then they say Maggie. So they enter Maggie. The next time they come in, someone else will be at the front desk, will ask that person, what's your name? They'll say Margaret, and then they're looking for Margaret Smith. Meanwhile, there's a Maggie Smith that was registered before, and they can't find this this Margaret Smith. And so if someone at the front desk enters that name as Margaret Smith, then it ends up being a duplicate. Now, one thing I have to say on the back end, there have been guards that have been put in place to help and prevent those duplicates as much as possible, but still some will go through. An example of this is when you have someone that an example of this is usually, where they'll put guards in place that someone does a search, there'll be at least 3 items. And usually it will be maybe the first part of someone's name. It tends to be 3 characters. It could be for example, my name is Rachel, as you see it down here on the slide. And then they first put the first 3 RAC. The last could be KEY. And then they also RAC, KEY, and then they put also the date of birth. So those help to identify someone. However, you find that sometimes this might happen. And the reason this happens is because depending on where the patient has been, they could re-register them under a different name, or the people in another department, the person helping may not really have a good grasp of how things are, like use those 3 criteria to pull up names, and they end up re-registering a person, again, using, for example, Margaret Smith instead of Maggie Smith, or Drew instead of Andrew, those kinds of things, short names, and maybe even someone's pet name and things like that. So they're guards put in place. It's in the algorithm actually on the back end. However, still sometimes things escape. So those are the main problems during registration that are prevalent almost every organization. So I hope this has been helpful. The reason I wanted to really go through this is because as a leader or anyone that going to work in healthcare, these are the main areas that you need to know in registration and what happens there, what type of information is collected. And that each and every one of the areas I'm talking about in this series is a reason to put a project in it. So if you go and start working on a project, or if you're a leader, you're able to talk to these areas, okay? For project management, because each is going to be done not necessarily separately, but as the project progresses, it's very helpful for you as a project manager to know exactly what happens where, especially when you're going to create the project schedule and project plan and schedule, and things like that. And even though that you have subject matter experts, the SMEs, that you will have a good grasp as you're talking to them, and maybe they're advising you about some of the ways that the system itself works, because you may not know the details of that, or sometimes you might know it. So either way, okay? So hopefully this is helpful. If you have any questions, feel free to definitely reach out. But I hope that this has been helpful. Okay, thank you.